Welcome to Metta Health Talk. Today we are tackling a subject that has caused more anxiety, depression, and relationship issues for men than perhaps any other topic in medical history. The question is, does penis size affect sexual pleasure? If you browse the internet or watch adult entertainment, you would believe that the average man is 8 inches long, and that anything less than that is inadequate. This is a statistical. The prevalence of Penile Dysmorphic Disorder, believing you are small when you are actually normal, is at an all-time high. Today, we are going to look at the hard data from 50,000 men. We are going to look at the anatomy of the nerve endings in the female body. And we are going to answer from a strictly medical perspective. Does penis matter? And if so, is it length or girth that actually does the work? First, let's establish the baseline. Forget what you see in movies. Those data are selected because they are statistical outliers. The most comprehensive study to data was published in the British Journal of Urology International by Dr. David Veale. They measured over 50,000 men across all races and ages. Here is the reality. The average flaccid length is 3.6 inches. The average erect length is 5.16 inches. If you are 5.2 inches, you are technically above average. If you are 6 inches, you are in the top 15%. If you are 7 inches or more, you are in the top 2%. The vast majority of men who think they are small are actually sitting squarely in the middle of the bell curve. Medically, unless you are in the bottom 2.5% micropenis, your hardware is functional. Now let's look at the receiver. Does a longer penis provide more pleasure to a female partner? Anatomically, the answer is largely no. The vagina is a muscular canal, usually about 3 to 4 inches deep at rest, and stretching to 5 or 6 inches when aroused, the tiny effect. However, 90% of the vaginal nerve endings are concentrated in the outer one-third of the canal. This creates a sensitive ring at the entrance. The deeper two-thirds of the vagina has very few touch receptors. It's mostly sensitive to pleasure, stretch, but not fine touch. This means that a penis that is 4 inches long stimulates the exact same nerve-rich area as a penis that is 8 inches long. The extra length is thrusting into the nerve zone of the canal. Therefore, excessive length adds no additional neurological stimulation for the majority of women. If length doesn't matter much, what about girth, thickness, circumference? Studies show that for female physiological pleasure, girth is significantly more important than length. Why? Because of mechanoreceptors, the vaginal walls. Specifically, the sensitive outer third and the pelvic floor muscles are packed with stretch receptors. These nerves fire signals to the brain when they are stretched outward. The thicker penis stretches the vaginal opening and the walls more effectively, creating a sensation of fullness and engaging the clitoral legs that wrap around the vagina. A very long but thin penis may not trigger these stretch receptors. In a study published in PLOS One, women were asked to select model sizes for different relationships. For long-term partners, they consistently prioritize girth over length. Why? Because girth provides consistent stimulation of the clitoris and vaginal introitus without the pain of deep cervical collision. This brings up to the dark side of the bigger is better myth. In medicine, we see a condition called deep Dyspareunia, pain during deep intercourse. At the top of the vaginal canal sits the cervix, the next of the womb. The cervix is dense and sensitive. If a man is significantly longer than the aroused vaginal depth, such as over 6 or 5 or 7 inches, he will repeatedly hit the cervix. For most women, this doesn't feel good. It feels like a bruise being punched. It creates a deep, sickening ache in the stomach. This causes the women to tense up, guarding, which makes sex even more painful. Many couples with well-endowed men have to restrict position to prevent him from going too deep. So while men dream of being huge, the medical reality is often one of caution, limitation, and fear of causing pain. Being average 5 to 6 inches is actually the Goldilocks zone. Long enough to stimulate, but short enough to go fully in without hurting the partner. If the average is 5.16 inches, why do so many men think they are small? This is a matter of perspective physics. 1. The visual angle. When you look down at your own penis, you are seeing it from a foreshortened angle. You are also usually looking past your belly, which hides the base. When you look at another man in a locker room or video, you see them from the side or front, which shows the full length. You are literally comparing a bad camera angle to a good one. 2. The grower versus shower. Genetics. Plastic size has very little correlation to erect size. Some men hang long when soft but don't grow much. Showers. Some contract very small when soft but expand 300% when erect. Slowers. Judging yourself by your soft size is a cold bathroom mirror is medically irrelevant. The only metric that matters is functional erect size. Since you cannot change your size, pills and pumps don't work permanently. The medical focus must shift to biomechanics. Pleasure is often about targeting specific zones. 1. The G-spot, located on the front wall of the vagina, about 2 inches in. A curved penis or an angle thrust stimulates this better than a long, straight one. 2. The A-spot, anterior fornix, located deeper on the front wall. The angle of attack matters more than the depth, because the clitoris has internal legs that hug the canal. Grinding often produces significantly more pleasure for women than thrusting in and out motion. Thrusting stimulates the insensitive deep vagina. Grinding's the nerve-rich outer ring are the internal clitoris. Men worried about size should focus on staying shallow but grinding firmly. This maximizes girth stimulation and clitoral contact, which, as we learned, is a biological key to female orgasm. We must define the clinical condition. Micropenis is a specific medical diagnosis. It is defined as a penis that is 2.5 standard deviations below the mean. In numbers, this means an erect length of less than 2.75 inches, 7 cm. This condition is rare, 0.6% of the population, and is usually caused by hormonal deficiencies in the womb or genetic conditions like Klinefelter syndrome. If you are 3 inches or 4 inches erect, you don't have a micropenis, you have a small normal penis. Even in cases of true micropenis, sexual pleasure is possible. The nerve density of the glands is the same. The ability to ejaculate is the same, with the use of positions, toys, or oral stimulation. Partner of men with micropenis report high satisfaction levels because, again, intercourse is really the sole driver of female orgasm. To conclude, does size affect pleasure? For the man, no. Sensation comes from friction regardless of size. For the women, girth matters for stretch, but length is overrated and potentially painful. The medical reality is that sexual satisfaction is not determined by a tape measure. It's determined by compatibility. If a woman has a shallow canal, a smaller man is the perfect anatomical match. If a woman has high vaginal laxity, a thicker man might provide more sensation. But for over 95% of the population, your equipment is standard. The problem is almost always in the mind, not the pants. Stop measuring, start communicating, and focus on the technique. Thank you for watching the Metta Health Talk. Please subscribe for more honest science-backed truths about your body.